She's the director of. Actually, I'm gonna let you introduce yourself, Miss Mills, Nurse Mills. Who are you and where are you from?
Hi, yes, I'm Dr. Erica Mills. I'm originally from Moss Point, Mississippi. I reside in Atlanta, Georgia now. Been here for about 7 years. I am on the board of directors for the Georgia Nurses Association as the director of public policy and legislation. And also, I am the magnet program director here at Grady Health System.
Like excellence, right there. You're also a realtor, I saw as well.
Yes, I am a realtor.
Boom, boom, boom. That's a lot of hustles, man. A lot of hustles you got going on.
Yes.
So let's kind of get right into the meat of this. A lot of people are, of course, the virus is the main thing that everybody out there is talking about. From your position, what can we, as the general public, do to remain safe with all the stuff that's going on?
I think it's very important that you remember your hand washing. That's always the single most important thing that you can do to keep yourself safe, keep your family safe, and keep others safe. Because we use our hands so much, way more than we really realize. We're touching things all day long, touching our faces, we're touching our phones and things like that. So remember to wash your hands for 20 seconds anytime that you touch the door of the public areas that other people are touching, or even like the common areas in your home. You want to wash your hands for 20 seconds. There's lots of songs that you can sing to help you get through that 20 seconds and to really time yourself, because 20 seconds seems a lot longer, when you're counting. And that we do know that like this COVID virus is like a super virus. And so
Mhm.
it doesn't just wash off easily. So you have to vigorously scrub, make sure you get the backs of your hands and fingers, really get that friction going for that 20 seconds, and then you rinse it off. Make sure you don't touch the faucet again with your bare hands. You use a paper towel to
Mhm.
turn the faucet off, and then dry your hands off real good. Use your antibacterial gels and sprays and wipes and things like that as often as you can. Wipe down your phones, wipe down anything that is commonly touched, like those doorknobs, those light switches, things like
Mhm.
that. Another thing that we can do is make sure that you are wearing something to cover your nose and your mouth, and preferably your eyes, even.
Mhm.
As often as possible, especially if you're going out to the grocery store or running out to the pharmacy or doing any other essential things. You don't have to wear a mask like if you're in the car by yourself, or in a room by yourself, or even in your house. But definitely if you're within 6 feet of someone else, if you can't
Mhm.
maintain that safe 6 feet distance, then you need to have on a mask, and um, science is even telling us now that this virus can be spread by way of us just talking. You know how you've had conversations with people before where there's spit flying,
Yeah,
and so the virus can actually come out with that, and it can land in your eye, or or something like that, and then
crazy.
you're inoculated, and you become ill after that.
So, what's so different about this virus versus things in the past? Because, Ebola was something that really scared people just because of how violent it was. But this has, like never before, shut the whole world down. Everybody is, practicing social distancing, or at least that's what we're being told to do.
Mhm.
What, besides, is it just because it's so contagious? Is that what it is? Or,
Well, I think the thing that's most serious about this virus is that is new. It is a novel concept. We've
mm,
not experienced it before, and so we are still learning a lot about the virus as
mm,
days go by. And I think that's the part that has everybody kind of in an uproar and panic, because Ebola had been around for years. There was an outbreak of it, but
mm,
it had been pretty much so it had been contained, over the
right.
years. Whereas this one, we've never seen it in history before. So everything that we're learning about it is all new and cutting edge, and it's just a lot of trial and error at this point. So that's, I think, the deadliest thing about it, because we just don't know, and sometimes ignorance can be bliss.
Mm,
There's lots of people still walking around that are carriers that don't even know anything about it because of the lack of testing equipment and ability to be tested. So, we've got a lot of carriers walking around. They're saying that, one person can infect 10, 15 people.
Hmm.
And a lot of people are just going on about their regular lives because they don't have any symptoms,
Right.
and that's the deadliest things about it.
So I was talking with a in my profession, myself and a couple others on my team, we travel a good bit. Typically on a Monday, we hop on a plane, fly to where we're going to go, and Friday we fly back home to wherever our base is. And I could have sworn I had it. I had it, and I think my coworker had it as well. I may have given it to him back in like early January because I was super sick. Went to the doctor. They was like, "Well, you don't have the flu, you don't have pneumonia," but I was down for like 2 weeks. And he had it, same thing. He tested negative for all that stuff. How long do you think this has it been around before it started getting all this mainstream attention?
Well, we know that China started to experience it somewhere around October,
Okay.
and it took them, up until February time frame, February, March, to start um, reporting that they were not having any new cases. So the literature is suggesting that some people may have had it as early as November, December time frame, and just didn't know what it was.
Absolutely.
Mhm.
So, what can with timeline again? I work with a lot of folks who are, automotive professionals, general managers, dealer principals. We work in the business of people. I'm saying? That's how we make our money, helping people to buy new cars. With all this, stuff that's coming out, it's just not safe. It appears for us to be open for business in the traditional way. What timeline can you see this thing starting to possibly taper off?
Well, I have
And that's a
read.
difficult question to answer.
Yeah, I've read some reports, and according to the latest reports, the peak here in Georgia is supposed to be around the 23rd of April. That's going to be like the most cases. Now, keep in mind that every day we influence the curve. If we can flatten the curve by people staying away and not giving this virus new hosts and not passing it along, then we may not see that big peak like we're expecting. However, if it's going on the trajectory that it's been going, then yes, we're going to see more cases by the 20th, 23rd. And then they say around June 1st is when it'll start to taper off.
Okay.
So that literature is available, and there's a website that's recommended by the CDC and supported by these doctors.
How are we handling this in Georgia? Is it, I know New York is, sounds like it's ground zero out there. It's like super crazy. They're demanding more ventilators. And I think we're starting to see more videos of doctors just speaking out saying, hey, we need legit help. What we have is not enough.
Right.
How is it, what's the situation for us at, our hospitals out here?
Well, we do know that around the state, we're gonna with the projections, the current projections, we're gonna be short critical care beds in all of the different hospitals. Collectively, they're looking at around 100 beds short. But again, we can influence this every day by staying in our houses, keeping our mask on, washing our hands, not giving this virus the transport. We need to really do our part and help with the situation. I know Albany is hard hit right now. They are busting at the seams. They're at capacity as far as their critical care, and there are other facilities, old facilities that are had not been in use in recent years, have had to open up to make room for all these very, very ill patients. Here in the metro area, we are seeing an influx of very ill patients as well that are in critical care and in need of ventilators and things like that. So we are feeling the brunt as well of
Hmm.
the virus. Not nearly as many cases as places like California and New York. But again, we just all have to do our part so that we don't get there because it can happen very quickly.
Once this is all over, do you see us returning back to normal, or is there, a concern for this whole thing coming back again and kind of ramping back up?
Um, well, I mean, China has reported that they have seen some reinfections. And so I think that we're going to try to get back to normal as possible. But I don't know if I could really project what normal looks like anymore. I think that we have to follow the leaders, our government officials
Mhm.
lead, and just always stay vigilant and um, I think that more so than anything, like as nurses and doctors and healthcare professionals, we actually have a part of our schooling that is dedicated to hand washing and putting on protective equipment and keeping others safe and keeping ourselves safe. And there are a lot of professionals and lay people are not privileged to that information. So this may be the first time they're really even getting access to wear a mask or or even having to put on gloves and things like that. So we cringe at the thought of people cross contaminating, wearing these gloves and touching everything, then touching our food and touching their cell phones, touching their face, all those type of things. Those are things that as healthcare professionals we already know and we hold very near to our hearts. I've always felt like all health professionals have a little part of OCD in them. And so I think that everybody will go back with taking away the importance of hand washing and kind of knowing who you're letting in your house and things
Absolutely.
like that. So
One
we're all learning, I think.
one thing I do love about this, I was talking to my guy Norval out there in Conyers yesterday about this, is that with all the stuff that's going on, it's kind of bringing it back to, families getting a lot closer. I know I've never been a person to really grill that much, but shoot, since this thing started, I've been grilling every single day.
Oh
That's
wow.
definitely a positive, teaching my boys how to grill and start fires and stuff like that. So that's one positive I think we can all take out of this kind of return to the family unit, getting closer,
Yeah.
especially with all this digital stuff that's going on. So I know y'all are pretty. I'm sure y'all are pretty hectic out there as well. What are some of the things y'all are doing to kind of keep y'all self, de-stressed when y'all going into these hospitals?
Well, we have had the outpouring of support from many of the different people in the community,
Hmm.
businesses, our partners. They have been sending in lunch, they've been sending in breakfast, they've been sending in hand sanitizers and wipes. They are doing everything they can from afar, to help us in our time of need and sending all types of webinars and meditation guides and things like that that can help us with decompressing. I know one thing that I've been really enjoying is looking at the lives for like DJ Nice and a lot of the local DJs.
Right.
They're doing their sets on the weekends and they're just doing it for hours and just, everybody's in there and everybody's using their imagination like they're at these pretend clubs, bars, and parties. And it just kind of takes your mind away from being in those four walls. I've also done a lot of virtual tours on, I love aquariums. Lots of different aquariums offer virtual tours where they have cameras that are just on 24 hours inside of their aquariums. And
Wow.
you can just look like in the shark tank or in, the tropical fish tank and even museums. You can do, virtual tours of museums. And I've seen a live poetry show this one real good guy named Tyler.
Mhm.
Um, he does he called it the Cash App comedy show, and so he does like an hour, 2 hour set, and it's just been really cool. I even looked at a live John Legend performance from his home. I
Mhm.
thought that was really awesome. So I've been staying very well entertained. I've also been doing some projects around the house. I planted flowers and um, I organized some things and just have been putting up pictures and doing things around my own habitat. But like, when I get home to work, We all just talk about things that we're experiencing and feeling. A lot of the nurses will stop by because I'm in administration. A lot of nurses will stop by and talk to me about their stories and their experiences with the COVID patients, both good and bad.
Hmm.
We'll laugh and we'll cry together at our 6 feet apart distance, through their mask, my mask, our all of our PPE.
OPP, yes, ma'am.
Yeah.
So, Rick Santiago actually had a quick question. He asked, "Is the coronavirus zoonotic?" I'm not sure what that term means.
Is it what?
Zoonotic?
What's No, I don't know what that means.
Yeah, I'm not sure either. Maybe it was a misspelling. Hopefully, it'll come back and I'll post it again. Another quick question I had as well is, I'm trying to think what else we can talk about. What all, so, it sounds like we're, for the most part, just got to push through and hopefully, just kind of a wait and see thing. I don't think anybody has an expected timeline for when all this stuff is supposed to end. You know what I'm saying? Is there any other advice you can give to folks out there who are, I'm saying, kind of struggling with this whole deal or that are panicking right now?
Well, I would just say, limit your exposure to other people for now. Don't allow anybody in your house who does not live there for now, even if you know them, because again, I don't think that anybody would knowingly infect you, but they may not know that they've been infected.
Mm,
It takes sometimes 2 to 14 days for you to start exhibiting symptoms after you have come across someone who has passed that on to you, and you may or may not exhibit symptoms, even if you've been exposed to it. So just be real safe. Try to still go outside, get your vitamin D, take a walk, go to some of the hiking trails. I know that there's the new Michelle Obama trail in Decatur that I would love to check out.
mm.
Do some bike riding. This is a great time to start spring training. I always say I spring train so that I can, be ready in the summertime
That's
for,
nobody,
uh,
right?
yeah, for bikini season, and
Mhm.
be out by the pool and things like that. So don't just sit in the house and eat and mope. You have to get that vitamin D, that sunshine in, because that's going to help you with not only with your bones but also with your mood. Do something fun. Don't just sit around if you're working from home or if you're still having to go into work. Still do something that's fun. I know that you can't really go out anywhere, but bring fun into you. You like to paint. If you have hobbies, this is a great time to really spend some time. Um, Reconnecting with those type of things. Anything that you can do to decompress, do that. I love also. I want to put a plug in for all the different online services that have been happening with the churches. I have not only been DJ hopping, but also church hop and get all the messages
Word.
that I can get. I love this. I love the singing. I appreciate the messages. All of them are very timely. They all relate to what we're going through right now, and it has been a blessing for me. And I
Mhm.
hope that everybody else will also take the opportunity to get these messages, and also that can kind of help you to see if this is a church that you might want to visit when it's safe to start going out again.
Absolutely. So, well, I think we're going to kind of pull to a close. I don't want to keep you on for too long, but thank you so much, Miss Erica, for coming on, Dr. Mills, for coming on. Anything else that you want to leave us with before we disconnect?
I just wanted to say, thank you for the opportunity to speak to your audience today. I hope that everybody appreciates your time and your effort for teaching in the community and making sure that they get relevant information. And while I'm on that topic, just know that not all information is good information. You want to make sure you stick with medical professionals or people who are well read. Also, go to the literature. I suggested that you follow the CDC, the
Mhm.
WHO, the World Health Organization, the infectious disease doctors, the Surgeon General. Those are people that I trust and that I get information from. I'm not going to listen to medical advice from somebody who sells balloons. I'm
Yeah.
just like, I need to make sure everybody stays kind of in their lane, you know. And right now, your healthcare professionals are the ones that you can trust and you can really get a good idea from. I know that some people think that it may be a conspiracy theory or some other things that may be going on.
Mhm.
And who knows? I'm not here to dispel that rumor, but I am here to say that here we are in the middle of this pandemic. It's very real. Um, the healthcare system is being flooded. You know, your nurses, your doctors, and your other healthcare providers are urging you to keep yourself safe, so we don't have to see you on this end of it. We want to see everybody doing well and healthy. It's not just old people that are dying. We've got very young people who are also dying, and then you also have old and young people who are getting well. But the thing about it is, you don't know what your situation may be like. So, in order for you not to have to worry about that, keep yourself healthy.
Another quick question just rolled in. Ashley asked, "What are the signs that indicate you should go to the doctor?"
Well, we actually are not advising you to go to the doctor as much as we are advising you to call your doctor. You should have a
Mhm.
primary care physician. If you do not, then you can call your local health department. You can tell them about your signs and symptoms. But here are some of the signs and symptoms that you should look for. If you have lost your sense of smell, your taste, if you have a fever, if you have a cough, and you don't have to have all these things, but these are some of the things that we are noticing that patients are reporting over and over. So if you have any of those things going on, as well as like any flu-like symptoms, then you want to speak with your healthcare provider. Let them know everything that's going on, how long it's been going on, and then they will let you know if you should come in for testing. Because even though you have symptoms, you still may not qualify for testing. The testing supplies are very limited, and what we're trying to do is test those who are in vulnerable populations, like our elderly or people who have underlying problems that may cause them to deteriorate much faster.
Mhm.
So, not everyone will get tested, even if you have symptoms. If you start to feel different, or if you feel like you may be exhibiting symptoms, the first thing you want to do is take yourself away from everybody. Take yourself away from your spouse, your kids, your family. Don't go to work. Stay at home, call your healthcare provider, and then let them advise you further.
Okay. No,
The only reason why I would say go to the hospital or to the a medical facility would be if you're having issues with breathing, because that is the most advanced sign and symptom, you know, that tells us that you really need to have you know, support
okay,
with breathing.
I got you. Another question was, do we actually need to wear masks outside?
If you're out in open air, or if you're in your home, in your car, you do not need to wear a mask. You do need to wear a mask if it's not, if you're not capable of maintaining that 6 feet distance. Say, for instance, if you're in a hallway or you're working around other people who may be within that 6 feet, then yes, you need to wear a mask.
Okay, cool.
If you're going into a store, if you're walking in and out of your place of employment, and you might walk past other people who may be breathing in that direction. We do know that it again, it can come out as people are talking. It also can be, it's droplet, so that means that it gets on the saliva and the moisture that you breathe in and out, and it can actually transfer to other people, and it can go into other people's eyes, or you know, if you get it in your nose, or you know, of
Mhm.
course in your mouth, any of your openings. That's how you become infected.
Cool, cool. I don't see any more questions at the moment. So I guess we will go ahead and sign off here. Let me double check one last time. Nope, that's it. Well, again, thank you so much, Dr. Mills. Of course, if y'all have any questions, feel free to comment. I'm going to tag Nurse Mills in this for you guys. And thank you again for your time, man.
Absolutely, y'all stay safe out there.
For sure. Y'all be safe. This has been your boy Deric Bump said on the UpBus podcast number 30. Y'all be safe. Keep hustling.